If you could take a blood test and learn decades before any symptoms were present that you were at risk for dementia, what would you change? That's a profound question, medically and philosophically, and thanks to a new study out of UVM, a scenario that may become reality. We're learning more about it today on Across the Fence. Hello, Vermont. When you can't recall someone's name or walk into a room and can't remember why you went in there, do you worry? I do. So I'm very curious to learn more about the implications of new research coming out of UVM's Larner College of Medicine, indicating that brain changes associated with dementia happen decades before the onset of symptoms. And when I say curious, let's be real, I'm also a little terrified. Joining me today is Dr. Mary Cushman, the senior author of the study we're going to be talking about, which was published in Neurology, the Journal of the American Academy of Neurology. Dr. Cushman is Vice Chair of Medicine and co-director of the Vermont Center for Cardiovascular and Brain Health at the UVM Larner College of Medicine. Dr. Cushman, welcome.
Thank you, Amy. It's great to be here.
It's very good to have you here today, even if I am a little bit on edge about this conversation. And I'll just go ahead and preface it. This is something that is in my family. My father had Alzheimer's. His mother had Alzheimer's. My grandmother on my mother's side of the family had Alzheimer's. So I've been around this disease, and I'm going to ask you in a little bit a basic question about Alzheimer's and dementia, so I get clarification. But I've been around it, and it's hard. I think probably a lot of people have had experience with family members, loved ones going through dementia. And then as we age, you start to see all of those little things that creep up, the places where we don't feel as sharp. So, like I said, I'm going to start with terror because I can't be alone in having a mixed reaction, emotional reaction to the study's potential outcome, the idea that you can take a blood test and learn more about your risk. So, start with a question. Outside of your clinical world, how have people in your life responded to this?
Well, the people in my life that are closest to me tend to be my family members. And of course, they're always very interested in what I'm doing. And so I think they feel good.
Do they pepper you with questions about dementia and about their prospects?
They think it's pretty cool.
They think it's cool.
They don't really pepper me. No.
Well, I would say that we did.
Maybe they're more used to being around me. But,
well, I will say we had like an office poll, an informal office poll of 3 people, and I'd say we're about, 75%, 25%. Of course, that's 3 people, 4 people, about whether or not we would want to take the test and find out. I mean, have you had that conversation with folks about whether they would want to know?
Yes, and everybody has a different answer.
Yeah. It's very personal.
Everybody has a different
answer.
answer.
Yeah, for many people, knowledge is power, and get on top of it. And I think that's the point, obviously. And we're going to talk more about that, too. But yeah, knowledge is power. We can start with there. Okay, so let's...
And that's my true belief.
And that is your true belief?
Yes.
Yes. Okay, well, let's talk about the study. So tell us about what you learned.
So we have this amazing study called REGARDS, which stands for Reasons for Geographic and Racial Differences in Stroke. And it's been going on since 2003. Where we enrolled and are following 30,000 people all around the country. And our laboratory at UVM is the central laboratory for the study. So we collected blood samples and stored them in our biorepository over the decades. And we analyzed these blood samples from the baseline visit of the study on about 725 people who were free of any baseline cognitive problems.
Okay. So not presenting with any...
So nothing going on.
Okay.
And the people had cognitive testing battery every 2 years during follow-up over about 12 years of average follow-up.
This is a high quality study.
Yes.
Because we have a large population, we have a diverse population, and we also have a longitudinal study.
Yes, they are black and white individuals and men and women, about half and half. And so we took those, we have this technology in our laboratory that allows us to measure proteins or substances in the blood or in the circulation that leak out of brain tissue when the brain tissue is damaged in some way. And they circulate at extremely low concentrations. So this special technology instrumentation that we have allows us to measure these proteins.
It's very sensitive.
Which, 5, 10 years ago, it wasn't possible.
Okay.
And so we measured those in these people and then related the baseline levels of these factors to the occurrence of cognitive problems over time, what we call cognitive impairment. And we were able to show very strong relationships. And so what this is telling us is that before you have any cognitive issues, we can detect damage in the brain that is related to the pathology that's leading to cognitive problems in the future.
So that the biomarkers are already an indicator of what could develop over time.
Right. And what's very exciting about it is that these proteins we're measuring, they don't come from other places in the body. They come from the brain.
So it's
they
a fairly
come from neurons,
conclusive test.
Yes. Okay. So, you know, it's really exciting. And from the science point of view, it's really exciting to think that that's possible.
Yeah.
From the, you know, public point of view, it raises questions about whether these tests could be useful, which we didn't address in this study exactly.
Yeah, and so now if I understand it, we've known about some of these biomarkers before, but so then what was different about this study from the previous studies that had looked at the same type of biomarkers?
Yeah, that's a great question. So there are a suite of these lab measures in development, and they've been studied in the past primarily in populations of patients that are referred to memory clinics because they're already having problems. Okay. And in these cases, some of these lab tests are helpful or potentially helpful in the diagnosis, say of Alzheimer's disease.
Okay. All right.
And so that's where they are starting in the infancy of being used, some of them.
So this is the big difference about this is the fact that this might be a test that can be used on a person who's just, I'm aging and I'd like to know.
Right.
I mean, is that really who the market for this would be?
Yeah, and the people in our study were age 45 and older.
Okay.
And so
you get to your 40s, and here's one more thing, one more test that you can't wait to take.
And, you know, even and we adjusted for age in our analysis, as well as all the other risk factors for dementia. Okay. And the associations remain robust when you would account for all those other things.
Well, you just mentioned Alzheimer's, and I had mentioned at the beginning that I was going to ask you some basic questions. So can you explain the difference between Alzheimer's and dementia? Is there a difference?
Yeah, so dementia is a family of brain disorders, with Alzheimer's being the most common form. So Alzheimer's is a form of dementia. Okay. But
so if you have Alzheimer's, you have dementia.
Yes.
But is it like the square and the rectangle? If you have dementia, you do not necessarily have Alzheimer's.
Not necessarily. Okay. And even for Alzheimer's disease, there are vascular contributions. Okay. There are vascular components. So there's something called vascular dementia, which is has a little bit different of a clinical presentation when it's kind of its pure thing. But even in Alzheimer's disease, there's most often or very often a component of vascular contributions. We call it vascular contributions to cognitive impairment.
But this test would this be a test that could also test for Alzheimer's, or kind of?
Well, we don't know.
We don't know. Okay.
So in our study, we just looked at impairment on testing, and what the definition we used means is that we were identifying people with mild impairment or worse. Okay. So we didn't really parse out.
Yeah, let's talk a little bit about the impairment, because the UVM put out a piece on this research, and it talked about, in its own quote, risk for cognitive impairment that can lead to dementia. Yes. So that seems to imply that cognitive impairment isn't necessarily determinative, or is it? I was wondering if you could explain that.
Yeah, not always.
Not always.
Not always.
Okay.
And
because we do all have a little bit of degradation as I mean, is that what
we do.
Am I right?
I definitely have times when I just have my senior moments.
Okay. And so and that's not the same thing. That doesn't necessarily mean that we're tracking toward dementia. Okay, well, that's good. Okay. Correct. And let's stay in the hopeful vein here, because I know ultimately that the hope for research like this is that what it can do in terms of behavior modification, right? So let's say we're all at risk because we are all going to get old. What can we do to take care of our brain health?
Right. So there's a few key factors. Okay. The first one is to have a healthy lifestyle, and really like a heart healthy lifestyle. Okay. So, healthy nutrition. And healthy levels of physical activity. Okay. And that starts from childhood. And what that does is it prevents the onset of risk factors.
Okay.
And the notion for this is the same for heart disease and stroke prevention, because these
All
common
related.
diseases are all interrelated.
Okay.
And so
We need to protect our vascular system.
exactly. So
Okay.
if you can prevent high blood pressure, hypertension in the first place,
So through
by
diet,
having a healthy
exercise.
lifestyle
Okay.
through your childhood, young adulthood, middle age, you're going a long way
Well,
to
if we-
protect your brain.
And if we can't go back and redo our childhoods,
We
because
can't.
we cannot, but we can still, we should be making certain types of changes. A
it's-
very impactful thing you said is blood pressure.
Yes.
So stay on top of your blood pressure.
Yes.
Know what your blood pressure is. And do you want to talk about changes to blood pressure, like at what level, at what moment a person should
Yes.
start treating their blood pressure?
So first, it's never too late to be on top of your blood pressure.
Okay.
And what we know, the definition of high blood pressure is a systolic blood pressure over 140. That's the primary thing for people to remember. And that's the top number.
Yes. Okay.
And so when I was a young doctor, the definition was above 160.
Right. And
And
now
it
I
keeps
think
going lower
it
and
keeps
lower,
going lower.
because we know at any
Okay.
level of elevated blood pressure, it's damaging the blood vessels.
Okay.
The
So we
blood
want the
is-
blood pressure. If you're over 130, then this is where you should actually.
If you're over 130, you should
130,
be watchful.
watchful.
If
over
you're over
140, you should be
140,
treating aggressively.
you should be definitely
Okay.
doing something about it. And the
Okay.
first step is always lifestyle change.
Okay.
So healthy diet, physical activity, stopping smoking can help.
Yeah.
And if that's not working, then medication
Okay.
is really easy. And people should not be afraid of it,
Don't be
because
afraid. This is an underlying theme. Don't be afraid.
there are simple,
Simple things we
inexpensive
can do.
medications
Okay.
that can be used.
Well, you're the director of the Vermont Center for Cardiovascular and Brain Health, and we only have about a minute, but how are heart and brain health connected? We talked about vasculature, but how are they connected?
Yes, so they're very interconnected.
Okay.
So the systems that lead to heart attack and that lead to stroke and
Also
that
lead
lead to
to-
cognitive problems
Yeah.
are overlapping.
Okay.
They're very similar. And so, you know, when you are protecting your heart,
Yeah.
you're also protecting your brain.
This is a very good takeaway message. So when we are protecting your heart, you are protecting your brain. There are things you can do. Lots of information today, but if you need or want more information about heart and brain health, here's the website. Dr. Cushman, thank you for joining me.
You're
I appreciated this. This is good things. I mean, even when we don't like to think about it, good to think about it. As always, Vermont, thank you for learning and exploring with me today, and thanks to the team that makes Across the Fence possible. I'm Amy Finley. This is Across the Fence. Come back and let's learn and explore again tomorrow.